Heart attack remains a leading cause of death worldwide. Many people confuse cardiac arrest and heart attack, assuming they are the same. According to American Heart Association, these are two distinct medical emergencies with very different cause, different signs, different treatment. Understanding the difference is crucial because heart attack is a circulatory problem while cardiac arrest is electrical problem. Recognizing the signs of each can help save a life through prompt and appropriate action. According to definition, heart attack occurs when blood flow to part of heart muscle is blocked with blood clot, while cardiac arrest occurs when the heart suddenly stops beating due to an electrical malfunction. What type of problem are these? Heart attack is circulatory problem, while cardiac arrest is electrical problem. Attack is usually a blockage in the coronary artery preventing oxygen to supply the heart tissues. When the heart tissues are not being supplied with oxygenated blood, you know what can happen. Arrest, on the other hand, it is the abnormal rhythm or arrhythmias such as ventricular fibrillation. The onset, or what is the onset of this cardiac arrest and heart attack is the onset is gradual. One will present with chest pain, pressure, while the onset is sudden. There is no warning signs and the person suddenly collapses immediately, and a lot of problems can set in if any action is not taken. Heart attack, a person may still breathe normal, but like there is a damage, but the heart can still beat. Yeah. When you have heart attack, the heart can still beat, or it is damaged. The heart can still beat, but it is damaged. But when you had when you arrest, the heart stop beating, or it can stop beating completely. I'll remain conscious with heart continues, though may be lobbed. But with cardiac arrest, breathing stop, become abnormal, and the person may start gasping, or the person will gasp. Attack, pulse are present, but cardiac arrest, the pulse are absent. What are the key symptoms of heart attack and cardiac arrest? Heart attack with chest pain, arm to the jaw, to the back. The person will have shortness of breath. The person can sweat, also can have nausea and vomiting. But with cardiac arrest, the person collapses, no pulse, no breathing. The person is dead. So with heart attack, if you experience that, if you get someone with heart attack, call emergency services, keep the person calm, give aspirin if advised, and monitor the condition. But when cardiac arrest occur, call emergency services, start CPR immediately, and use defibrillators if available. If are not available, take the person to the nearest facility. Remember, with little action, you can prevent death. So cardiac arrest, CPR and defibrillation can restore normal heart rhythm. But with heart attack, medication, stent or surgery can restore blood flow, because the problem is the blood flow to the tissues of the heart, or the muscles tissues of the heart. If heart attack is not treated, it can lead to death, or the muscles of the heart will be damaged. But if cardiac arrest is not treated, death is within minutes. So that is why I've said with less action immediately after cardiac arrest has occurred, it counts a lot. Heart attack can cause cardiac arrest, but cardiac arrest may occur as a result of heart attack, but can happen independently. Yeah, they can happen independently. But remember, cardiac arrest may occur, I'm not saying it is usually, may occur as a result of heart attack. Have in mind that heart attack is a circulatory problem and cardiac arrest is an electrical problem. So in summary, attack occurs when blood flow to the heart is blocked. Remember, the blood flow to the heart is blocked. What will happen? You can see what can happen. But cardiac arrest happen when the heart suddenly stop beating. Now, if the heart is not beating, the blood cannot be pumped. Both are life-threatening, but the response differ. Remember, both are life-threatening, but response differ. Heart attack, immediate medical action, and cardiac on the other hand require instant CPR and defibrillation. So remember, as the Heart Association emphasized, that every second count will mean the difference between life